Welcome, curious minds, to another deep dive. Today we're tackling a medical specialty that, well, it might sound like a bit of a mouthful, but it really impacts so much of our daily lives. Otorhinolaryngology. Our goal here is to, demystify this field a bit, understand its incredibly broad scope, and maybe reveal why it's so crucial for your well-being. We're drawing on a pretty comprehensive Wikipedia entry and also an explanatory article called Otorhinolaryngology, Ear, Nose, and Throat Conditions Explained.
That's right. And we're going to try and connect the dots between that maybe intimidating name and the vital functions it actually addresses. You might be surprised, honestly, at how much this specialty shapes your quality of life, often in ways you don't even think about, well, until something goes wrong.
Exactly. So what is otorhinolaryngology, really? And why is it, important for you to know about it? We'll get into the practical side and just how broad it is as we go. But first things first, that word, otorhinolaryngology. Let's unpack that. What's the story there?
Right. The name, well, it's actually a combination of Neo-Latin forms, but they all come from ancient Greek words. Pretty cool, actually. You've got nous, which comes from the Greek for ear, or its form otos. Then ris, that's nose. Then larynx, which is, well, the larynx or your voice box. And then the easy part, so the logia, meaning study. So put it all together, and it literally means the study of the ear, nose, and larynx. It's quite descriptive when you break it down like that.
It really is, which explains why most of the time we just hear the abbreviation, right? ENT, ear, nose, and throat. Much simpler. But yeah, there are other formal names too, like just otolaryngology, or the longer one, otolaryngology, head and neck surgery. You might see that shortened to ORLHNN or OHNS. And the doctors, well, you can call them otorhinolaryngologists if you want to be formal, or otolaryngologists, head and neck surgeons, or like you said, just ENT surgeons or physicians.
Exactly. So what does all that mean in practice? Well, basically, it's a surgical subspecialty within medicine. It deals with both the surgical and the medical management of a whole host of conditions affecting the head and neck. And what's really key to understand is that this isn't just for one age group. It covers everyone. I mean, from newborns with maybe birth defects like a cleft palate, right up to elderly patients dealing with things like age-related hearing loss or voice issues. It truly spans the entire lifetime.
That breadth is pretty amazing. Which makes me wonder, what does it actually take to become one of these specialists? An ENT doctor. It sounds like a really demanding path.
Oh, it is. It's an incredibly rigorous journey, huge dedication needed. First off, you have to be a physician. So complete medical school, get your MD, DO, MBBS, whatever the degree is. Then, after that, it's years of postgraduate surgical training, specifically in ORL-HNN, usually about 5 to 7 years. In the U.S. and Canada, for example, it's typically a 5-year residency. And I should add, it's actually one of the most competitive specialties to get into for residency. Really tough.
Wow. 5 years after medical school. Yeah, that's a serious commitment just to get started in the field.
Absolutely. And, for a lot of them, the training doesn't even stop there. Many, probably most, go on to do advanced subspecialty fellowships. That adds another 1 or 2 years. These let them specialize even further. Things like head and neck cancer surgery, facial plastic surgery, sinus surgery, neuro-otology, which is complex ear stuff, pediatric ENT, or laryngology for voice issues. So you're looking at, 12 to 14 years of education and training after high school? It's a long haul.
Incredible dedication. And I guess that level of expertise is reflected in, well, their compensation too.
It is. The sources mention that back in 2022, the average annual income in the U.S. was around $469,000. So yes, it's a demanding but also well-compensated field.
Okay, so they go through all this training. What does that actually mean for you, the listener? Let's maybe explore the huge range of conditions they actually manage, maybe sort of work our way through the different areas.
Sounds good. Let's start with the ears. This area falls under otology and neurotology. And when we talk about ears, it's not just hearing, although that's huge, it's also balance. Think about it. The precision needed to help someone whose world is constantly spinning from vertigo, or helping a child hear clearly for the first time. That's the kind of impact we're talking about. So they deal with the outer, middle, inner ear, the mastoid bone behind the ear, even the facial nerve sometimes. Common things are like otitis media middle ear infections, super common in kids.
Right, those can be relentless.
Exactly. And if they're persistent, they can actually affect speech development. So getting that treated is vital early on. They also treat tinnitus, that ringing or buzzing, hearing loss too, whether it's from aging, noise, infections, genetics.
So many causes for hearing loss.
And balance disorders like Meniere's disease or vestibular neuritis, which cause awful vertigo. Even simpler things like earwax blockage or a perforated eardrum from an injury or infection. Oh, and surfer's ear, exostoses. Bony growths in the ear canal from cold water exposure, and even Bell's palsy, that sudden facial paralysis. So yeah, symptoms like ear fullness, ear pain, otalgia, or fluid draining from the ear, otorrhea, those are definite signs to maybe see an ENT.
Okay, that's a lot just for the ears. So moving on from that intricate world, what about the nose and sinuses? That's rhinology, right? What kind of issues do they tackle there? Seems like breathing is key.
Absolutely key. Your nose and sinuses aren't just there for smelling, they're vital for breathing properly and filtering the air you take in. So, rhinologists handle, well, pretty much anything related to nasal dysfunction and sinus diseases. Things like allergic rhinitis, hay fever, basically. Chronic sinusitis is a big one. That long term inflammation, often with nasal polyps, that can make breathing miserable and often need surgery.
I know people who suffer terribly with chronic sinusitis.
It's very common. They also fix things like a deviated nasal septum where the wall inside your nose is crooked. That can cause breathing problems, recurrent infections, or other kinds of nasal obstruction, maybe enlarged turbinates, frequent nosebleeds, epistaxis, especially if you live somewhere dry or get nose injuries,
Yeah.
and even some pituitary tumors that are accessible through the nasal area.
Right. Okay, so next up, the throat and voice box. That's laryngology. Sounds crucial for, well, talking and eating.
Definitely. This specialty focuses on the pharynx, the throat area, the larynx, which is your voice box, and
Yes.
everything involved in swallowing. So common conditions would be things like tonsillitis and pharyngitis. Sometimes those require getting your tonsils out, a tonsillectomy. They also treat a huge range of voice issues, simple hoarseness from maybe overusing your voice, or more complex things like vocal cord nodules or polyps, even vocal cord cancer, unfortunately.
Nodules and polyps, like singers might get.
Exactly. Or teachers, people who use their voice a lot. They also treat conditions like Rinke's edema swelling of the vocal cords or spasmodic dysphonia, which causes these involuntary spasms in the voice, really impacts communication. And of course, swallowing disorders, dysphagia and laryngitis, just inflammation of the voice box. It even includes vocology, which is the science of helping people like professional voice users get the most out of their voice or recover it.
Fascinating. And then there's the broader category of head and neck surgery. That sounds like it covers some really serious conditions.
It does. This is where they deal with cancers and benign tumors throughout the head and neck region. Also, endocrine surgery, like thyroid surgery and complex reconstructions. So think cancers of the mouth tongue, gums the back of the throat, the voice box area, the sinuses, the nasopharynx. Also, skin cancers on the head and neck, which are very common. Thyroid cancer, salivary gland cancers, sarcomas in the head and neck region. It's a wide range of potentially life-threatening diseases. And thyroid and parathyroid surgery are a big part of this specialty, too.
Okay. Then there's facial plastic and reconstructive surgery. I think a lot of people might just think cosmetic here, but it sounds like it's much more than that.
You're absolutely right. While aesthetic procedures like rhinoplasty nose jobs or facelifts are part of it, a huge focus is on reconstruction, restoring form and function. So yes, they do rhinoplasty and septoplasty, often together to improve breathing and appearance. Facelifts, brow lifts, eyelid surgery, blepharoplasty, ear pinning, otoplasty, chin surgery, genioplasty, even cosmetic injectables. But critically, they also manage facial trauma, broken noses, jaw fractures, orbital fractures around the eye, complex cuts. And removing skin cancers like basal cell carcinoma often leaves defects that need careful reconstruction. So it's very much about restoring normalcy after injury or cancer, too.
That makes sense. It's about function just as much as form. Now, what about sleep surgery? Sleep apnea seems incredibly common these days.
It really is. And sleep surgery is a dedicated area within ENT focused specifically on treating obstructive sleep apnea, or OSA. That's the condition where your airway keeps collapsing while you sleep, causing snoring, pauses in breathing, and poor sleep quality. So ENT surgeons perform various procedures, often targeting different parts of the upper airway to basically open it up. This could involve fixing a deviated septum in the nose, removing tonsils or adenoids, trimming the soft palate in uvula, that's the uvulopalatal-pharyngoplasty or UPPP, or even procedures to move the tongue base or the jaw forward. Newer things, too, like stimulating the nerve that controls the tongue.
Wow, lots of different approaches.
Yeah, the goal is always to get you breathing clearly and consistently through the night. It can make a huge difference to someone's energy levels and overall health.
Now, this next one sounds incredibly complex. Microvascular reconstruction repair. What exactly does that involve?
It is truly amazing surgery. Think of it like moving a complex living piece of tissue, skin, bone, fat, muscle, maybe all combined from somewhere else on the patient's body, say their arm, leg, or back, up to the head or neck. It's most often used after removing large head and neck cancers, maybe involving the jaw, the tongue, the throat. It helps rebuild those areas. The microvascular part is the key. They have to reconnect the tiny blood vessels, the artery and veins of that transferred tissue to blood vessels in the neck. These vessels are tiny, like 1 to 3 millimeters across, so surgeons have to use powerful microscopes to meticulously sew them together.
Incredible precision.
Absolutely. It allows them to, say, rebuild a jawbone, restore tongue function as much as possible, or reconstruct the throat after cancer surgery. It's vital for quality of life afterwards.
And finally, rounding out the subspecialties, pediatric ENT. Children must present unique challenges, right?
They absolutely do. Pediatric ENT is all about diagnosing and treating ear, nose, and throat disorders specifically in kids. Their anatomy is different, their conditions can be different, and the approach needs to be tailored. Common things we see are enlarged tonsils and adenoids causing breathing or sleep issues, those recurrent ear infections we mentioned earlier, which can affect hearing and speech development. Also, congenital issues, things they're born with, like cleft lip and palate or airway abnormalities. Pediatric ENTs are often key in figuring out why a child might have speech or hearing delays. And they work really closely with pediatricians, audiologists, speech therapists. It's a team effort.
It's genuinely staggering, the sheer range they cover within that, head and neck area. So with all these complex conditions, how do they actually figure out what's going on? What are their diagnostic tools like?
Yeah, the tools have become quite sophisticated. For diagnosis, they have specialized scopes. There's the otoscope, that little light they use to look in your ear canal and at the eardrum. Then nasal endoscopy uses a thin camera to look right inside the nose and sinus passages. And laryngoscopy does the same for the voice box.
Right, those little cameras?
Exactly. Hearing tests, called audiometry, are obviously crucial for anything ear-related. And for complex stuff like deep sinus issues, tumors, or problems with the inner ear or neck structures, they'll use imaging like CT scans or MRIs to get a really detailed picture.
Okay, so once they have a diagnosis, what about treatment? Is it always surgery, or are there other options?
That's a good point. While it is a surgical subspecialty, they definitely manage many conditions medically first. Think antibiotics for infections, steroid sprays for allergies or sinus inflammation, medications for acid reflux affecting the throat. Lots of non-surgical approaches. But when surgery is needed, they do a huge variety. Some common ones people might have heard of are tonsillectomy and adenoidectomy, often for kids with breathing issues or chronic infections, septoplasty to straighten the septum in the nose. Endoscopic sinus surgery is very common now for chronic sinusitis. They place cochlear implants for profound hearing loss. And then there are the major cancer surgeries like laryngectomy, removing the voice box, or thyroidectomy for thyroid cancer or nodules.
And are these big, open surgeries typically?
Well, that's been a major change. Increasingly, many of these procedures are done using minimally invasive techniques. Using endoscopes, small cameras, specialized instruments. It often means smaller incisions, less pain, and quicker recovery times for the patient, which is obviously a huge benefit.
Definitely. Okay, this is all incredibly useful information, so let's bring it back to the listener. With this massive scope, how would you know if you actually need to see an ENT specialist? What are some practical red flags?
Right, that's the key takeaway, isn't it? When should you think about making that appointment? Well, definitely consider it if you have chronic sinus infections, the kind that just keep coming back or never fully clear up despite treatment from your regular doctor, or a persistent sore throat or hoarseness that hangs around for more than, say, 2 or 3 weeks. That needs checking out.
Okay, hoarseness especially seems like one people might ignore for a while.
They do, but it can sometimes be a sign of something more serious. Also, any noticeable trouble hearing or balance issues, feeling dizzy or unsteady that are impacting your life. Frequent ear infections are another big one, particularly in children, but adults too. If you know you have obstructive sleep apnea or even just really heavy disruptive snoring, an ENT consultation can be very helpful. And definitely any unexplained lumps or swellings in your neck or persistent difficulty swallowing or speaking, those absolutely warrant an evaluation by an ENT.
There's a really clear list. Thank you.
So just to kind of wrap up, Otorhinolaryngology, or ENT as we mostly call it, it's just such a critical and surprisingly broad area of medicine. It really plays a vital role in diagnosing and treating conditions that affect things we often take for granted, our ability to hear, to breathe easily, to speak clearly, to swallow. It touches lives across all ages, from the youngest babies to the oldest adults, often dramatically improving their quality of life.
It really is a field that blends, deep medical knowledge, incredibly advanced technology now, and real surgical precision. And it requires this holistic view of how interconnected everything in the head and neck really is. Just take a second and think about how, hopefully, seamlessly, your body handles hearing the world, breathing without a second thought, speaking clearly. It's amazing. And when any one of those things gets disrupted, it's very often an ENT specialist who has the skills to figure out why and help restore that balance, that quality of life. It really makes you think, doesn't it? What stands out to you about how intimately tied together all these systems are kind of makes you appreciate the complexity.
Well, thank you so much for joining us on this deep dive into the world of otorhinolaryngology. We really hope you found it informative, maybe even a little surprising, and have a better appreciation for the incredible work these specialists do.